He came in and then there was silence and he said, "Your daughter most probably has leukemia. The fact is you have to live with it and you have to find a way and like really propel this grief and the sadness into like motivation to change something in terms of medicines."
This is the story behind the story. This is the human side of leadership in biotech. Willing to win. Biotech leaders against all odds.
My guest today is Dominik Witzigmann. He did his PhD in Basel, then went to Vancouver and joined Pieter Cullis. Today, he is co-founder and president of NanoVation Therapeutics and CEO of the European entity. This episode is about the point where his work stopped being only professional. We talk about how he lived through the worst thing a parent can live through, what kept him going, and how he found a purpose that will outlast him. Hello, Dominik. Welcome.
Yeah, hi, Christian. Yeah, pleasure being with you today.
Great. Look, Dominik, 3 years ago, you wrote something on LinkedIn, and I want to read a part out of it because I think it has to be your words. You wrote, "Last month, we have lost the battle against lymphoblastic leukemia. However, the fight for thousands of others is not over." What did you mean specifically by that?
Yeah, it's a quite personal moment. Obviously, like it's about my daughter who passed away at close to the age of 4 because of leukemia. And yeah, I remember that day pretty well. And the reason why I posted, we can like talk about this later. And it's really that, she had like some kind of like sickness symptoms, like her brother had, like they were together in the same kindergarten. The older brother had like a stomach flu. We thought, okay, Lotta, our daughter, had the same. The coming days, she had some pain in her arms and legs. So we went to the hospital and like they did some X-ray to see if there was a fracture. But nothing. So we went home. And then the coming days, it didn't get better. So we went back and really asked the medical doctors, like, can you take her blood, do some analytics and see what's ongoing? There's something wrong with her. And we went home. And then in the afternoon, I got a call and they said, you have to immediately go to the hospital. And I knew there was something wrong. So we went to the hospital and they did some additional analytics. And then we were in this room waiting together, my wife, our like other son, and we brought to our parents. We're waiting there for the medical doctor. He came in and then there was silence and he said, "Your daughter most probably has leukemia." So this was really tough moment and we went through this fight and it was tough. And at the end, she passed away because we lost that fight against cancer. And this really had an impact on me, on my family, on like how I see the world and how I deal with the company I've co-founded and like overall, like how I manage life, I would say, and manage situations.
I cannot imagine such a situation. You said, went through the story quite quickly. Did you have an idea that this could be the case? Because you said, we wanted to do some blood work because of a gut feeling, or what was your thinking there?
Yeah, and I would say as a parent, you see your kids close to 24/7. You know your kids the best. And given the X-ray didn't show up any fracture and we were sent home and should take some painkiller and wait, but it didn't get better and we couldn't locate why should she have this pain. Like we really felt, and especially my wife, she felt something was wrong. We need to do something about it. Blood analytics is quite easy and will give a lot of information. So this was important that we did this. I think it's really about parents know their kids the best, and it's really listening to your heart and your gut feeling, and then asking for these tests. So no, I didn't expect this at all.
How did you handle it in the beginning and throughout? There was of course grief. There was of course all signs of grief, I guess. And I cannot imagine. I have a daughter myself now. I don't know how to relate to this, but maybe you can tell me the story, how you reacted, what kind of words you used to talk to yourself. How was your relationship to your wife? Maybe you can help me understand that.
Yeah. And I guess you are asking not about the day, like the diagnosis itself, but like when Lotta passed away. Is that correct?
Well, I think when you get the diagnosis, I guess you understand also the chances of
Yeah.
survival. So I
Yeah.
think it's the whole time of hope and fear, I guess.
And maybe like talking first about the diagnosis. Yeah, it's shocking. And it really like you lose everything in that moment, but there's always hope, even until the last end, until, yeah, we had several like at the end of where it was clear that it will be tough that she survives this and like she most probably will pass away. We had several conversations with medical doctors and about like this night she might not survive. And she did. And then the fight went on. And like this, like you never lose the hope until the last moment because you always hope there's like something, magical happening.
How much time passed from the first pain and her passing away?
Actually, it was really fast. It was 8 weeks.
8 weeks.
Acute leukemia can be incredibly fast. And we met other parents like afterwards, obviously. We met a lot of parents who lost their kids because of cancer or genetic diseases. And acute leukemia can be very aggressive. And we also met parents who lost their kids within 6 weeks or similar time frames. And the problem is with acute leukemia, you need the entire immune system is destroyed. You need immediate cancer therapy, which will also have an impact on the immune system. So it's quite a problem because you are very affected by this and can easily get like any infection by bacteria, viruses. And this was also
Yes.
troublesome for my daughter.
So let me go back to my question that I had. What kind of conversation did you have with yourself and with your wife?
A lot of conversation. At first, like at the start, you don't realize, like you don't want to believe that this is true, what just happened. And like when you lose your kid and like your kid passed away, there's nothing there how you can ever overcome this. So like you don't believe that. And like holds on for a really long time. But the fact is you have to live with it and you have to find a way how to, change that. And what helped us as a couple, as a family, like we have 2 other kids, is really talking a lot about it, meeting with other parents, because you realize quickly you're not alone. There are so many others who have lost their loved ones and a lot who have lost their kids. And this helped us a lot to really talk a lot about her, talk to other parents and express our feelings. And let's say this was nothing I ever thought could happen. And my approach to this was really like to fight for Lotta and like really propel this grief and the sadness into like motivation to change something in terms of medicines.
How did you do that? I mean, you are very reflective, that's for sure. But how did you do that?
It's a good question. I'm a very forward-looking and positive person, and you can never change the past. I would never have, as mentioned, would like to have this situation, but like I cannot change it, so I have to deal with it. And I can fully understand there have been families and parents who couldn't deal with it, and they were lost, and we were also lost. But like we had a lot of good friends, really good family. We kept fighting, and this really helped us. So it's. I think everyone will deal differently with it. For me, it's really like I have to look to the future and like how can I really like fight for her? And this is what means a lot to me. Like having her aside me where then there are troublesome situations, when there's uncertain situations, then Lotta, my daughter, helps me with these.
I think there has to be a pivotal moment when you change from grief to a transformation that changes the story. Was there such a moment?
Yeah.
Don't get me wrong. I think you need to grieve in some way.
Yeah, 100%. And
I would say, and it's ugly. And when people grieve with you, it's rather It's, I guess, good and bad. But maybe you can tell me about that.
Yeah, and I would say to the grief maybe first. I think this will when you lose your kid and your kid passes away, this will never end. Like the grief changes. Like at the beginning versus years after this, it's just like a different type of grief. But you will never stop doing that. And it sometimes comes in waves. But you asked me if there was a pivotal moment for that. I don't think so. It's I knew I want to change something. So even so she passed away, I then shortly after I had a lot of support from the team in that time. So I really appreciate my co-founders and the team who really supported me because we had NanoVation running, but then I also knew that NanoVation and the company I co-founded will help me to potentially have an impact and to change something. And this is what I learned for myself.
How much time did you take off?
Let's say I started slowly, but like I didn't actually like take too long time off because first of all, like our oldest son was in school. So like this also helps. You have to get back to the rhythm because there are other children.
So like we talk about weeks.
Yeah, like roughly 2 months or so. But like I can also understand there were other parents we have met who took off like several months, a year or longer. The way I deal with this was really like put my energy into the work, but also keep the family together and like talk a lot with my wife and the kids. But since we had other kids, the life had to go on.
Was there an external influence that helped you understand to transform that grief into positive outlook? Somebody who told you this helped us, maybe an affected parent, telling you the story. Maybe
I would say, yeah, talking to a lot of parents and like meeting parents who have lost their kids maybe several years before, because there's like during the time when Lotta was in the hospital, we were living in like there's a housing for families with kids with cancer. And they also like they have then a small group of like it's ever increasing group of people who have lost their kids. And there are people or families who have lost their kids and passed away several years ago. So it's good to talk with them and see how they reacted in terms of like you also then after something like this happens, you watch different videos and how others deal with that. And there's definitely like a professor in the US who has also co-founded a company focused on cancer. And I watched a talk of him and he like has shown the photo of his son because he has lost his son and he also transformed that. And this was kind of also a moment where I realized, okay, this is what drives me. This is like what I call my massive transformative purpose. Like what drives me every day, what keeps me going, what helps me to go one step more than I actually want to. And this is really like my daughter and like transforming that grief and this situation into power.
Yeah. I have so much interest in that transformation that you have there because I think that is absolutely helpful to anybody who is affected. How do you know that you are ready to transform?
Yeah, that's a very good question to ask. Yeah.
Do you wake up one day in the morning and say, okay, I'm sick of it. I don't want to grieve anymore. What is it?
I think it's continuously telling yourself like, what is the solution? Like you can grieve and you go on to grieve, but like, how can you transform that moment? And like, for me, it was really about what can I change? I will never get my daughter back. Okay. But like, I can help others. I can have an impact on people within the team. I can have an impact on patients, potentially with NanoVation and the partners we work with. And this is really like, what drives. So I wouldn't say that there's this one specific moment. It's quite personal. And since I'm a quite positive, like forward-looking person, I really was looking for solutions, how I can transform that.
Yes. There's a personality trait that I just can point towards. I mean, you said something like, what is the solution? What can I do about it? How can I change my situation? Is the source of it somewhere in your childhood, in your past? Did you learn that to think like that?
For sure, also in the childhood, in terms of like being a positive person, I grew up quite like I had a happy life and like a very positive life as a child. But I think it's also maybe the scientists in myself. Like scientists are looking for solutions, critically thinking, asking the right questions. I think it was also part to that to say, okay, there is a problem, but what is the solution to that? Like the problem, I have to overcome that challenge somehow. So only a solution will solve that. And I think it's the scientist and the scientific approach to that probably. And being quite rational about it.
Yeah. Being rational about emotions is tough. I think that that isn't part of everybody. But what about the relationships that you had? You mentioned the relationships in the company, they were very supportive. What about the relationship with your kids and your wife?
You have to, I would say, grow into the situations. For sure, it changed our entire life. But like, I think what helped us a lot and what is key and what I would tell everyone, talk about it. We met various couples who stopped talking about the kid who passed away. And I think it's really important to express your feelings, talk to each other, and also realize and accept that people grieve differently. Yeah. Your partner grieves differently, the kid, other kids and children, family who is surrounding you, friends, and you have to accept that. And I think that's a key moment. And for the team, like there was also a pivotal moment, I would say, when one of our board members, like obviously I was quite open and then told the team what happened and like how we can potentially deal with that. And as mentioned, had a lot of support. But one of our board members immediately wrote me, family first, above everything. And this was something which I always tell my team, because since that happened, like several of our team members have maybe lost their parents, the grandparents, some other loved ones. And the first thing I always write is like, family first, above everything. Your team will deal with it. Take time. We will handle it. Like, we are one team. And like this also, like the acronym I like is together, everyone achieves more. Team. And it's really like when people have to like take time for it themselves, the team has to jump in. And this is something I realized what this means in these situations. I think it's really these challenging times when you realize what you have and how you can deal with these situations.
Yes. You also wrote about the necessity of blood work, blood donor. How do you say it?
Blood donation, and stem cell donation. Let me shortly close. Sorry.
Why is it necessary?
Yeah. So blood donation and the stem cell donation, like two parts where I realized how much you can do for others. Like blood donation, when you have, especially leukemia, you need a lot of like blood during these therapies because your blood is destroyed. You need thrombocytes, like platelets. You need blood supply. And this is something which you can easily do every couple of months. You can go to donate your blood. And this is something what really like started then afterwards quite on a regular basis, but also always encourage the team. And there's the blood donation day, like where I think it's the June the 14th, where we say, around this event, let's encourage people within the team. And the team has also like organized events then to go to blood donation. And this is incredible to see because this is something you can easily do and like it will help others to survive. And the other part is like stem cell donation, because most leukemic patients, or also like patients with stem cell genetic disease, they need a stem cell transplantation in the worst case scenario, if they survive until that stage. And a stem cell donation means you get registered for the stem cell bank. And if there would ever be a patient who fits you, you would get a call and then you can like help that person to survive. You would have to go to the hospital, get a short kind of treatment that they can isolate your stem cells. But what does this mean in respect to you helping a person to survive? You help that family. And I think that's something like everyone should do. Register to be a stem cell donor because there are not enough people registered. And this is something where you can, and imagine that you can save someone's life.
What about stem cell donation at birth? Because we thought about it, for example, but I found out it wouldn't help the kid itself so much, but rather other people.
Yeah, definitely something we have also done. So I think, like, let's say it's everyone's own decision. I would say a stem cell donation at birth, or also a stem cell to register to be a stem cell donor is relatively easy. But you also have to realize, okay, at one point when you get the call, there is a person waiting for you. So whenever you get this call, you have to be ready. And this is the thing you have to be clear about from the start. Registration is easy, but when you get that call, you have to be ready. So don't say no at that moment, because I think that would be, because patients will know when there is a donor. So if you then say no, it's like devastating.
Devastating, yeah, absolutely. I like the idea that you involved your team also in participating in, the blood donation day and in everything that is also important to you. So how did you shape the company and your team after that event? What did you learn about it and what made it better?
Yeah. What I love about like having started NanoVation, but building companies, really like you bring your culture to the team and you bring your culture to the company. And there you can shape it by telling your story. And like I'm quite open with my story and like in general, but also especially with the team. And showing them what can we do as a team event. And I mentioned like we will organize this team event for blood donation, but also other events where, for example, in Vancouver, we have the Ronald McDonald House, where there's a housing for families who have kids with devastating diseases like cancer. So there you can go as a company, as a group of people, even with friends, and you can cook dinner for 100 families. It's just one dinner for you, but it means everything for that family because they are in the hospital. They are in really critical situations. They don't want to think about like what to eat, what to cook. So if you as a team go there
and
you can have fun and you can cook dinner, but at the
Really?
same time, you then like give the families the food. So you serve the food. So you realize and you have the contact to the people
Yeah.
if they want and the
Yeah.
patients and the families. And like, I know for myself how important these small gestures are because for them, it's like incredible, useful. And
What is the most underrated or the biggest myth about how you deal with that situation? My guess would be that people should leave you alone. What do you think?
Yeah. First myth is maybe that the grief stops. Let's say I know that older generations always had this 1 year of grief and then suddenly it's over. It's never over. This grief will go on. It's just like it changes how you deal with it.
Yeah.
So that's definitely one myth. The other thing is like leave people alone. I think it's we have so good friends and so good family that they came to us. They brought us like during the time, they brought us food, just like put a lasagna in front of our door, texted us, hey, there is food in front of your house, of your home. Like, I think one part which I really like also changed my mindset is not just offer help, but actually do it. So this is really something like when things like similar to that, or when friends, we have a friend who was diagnosed with cancer and like we have like met various families and we offer help. But now what changed, we also give help immediately because like at that situation, obviously we also got a lot of like messages like, let us know when you need help. At that moment, you for sure need help, but you just like, you don't have time to think about like what you actually need. So if someone just provides you that help, it makes things much easier. So when to your question was a myth, don't just offer help, but actually do it.
I like that. Yes. That's the difference. If you just say or ask, call me if you need help, nobody will call.
Yeah, exactly. Because you're in such an extreme situation that, you will not pick up the
phone. Still creates the barrier of, well, is this transfer even wanted? A burden or not? I think you're absolutely right. Yeah. Okay.
Yeah.
Let me understand your professional transformation a little. You started as a researcher in academia.
Yeah.
And by then you also had that curiosity and that problem solving capability, right? Tell me about that time. What was important back then for you?
Maybe I start with like going a bit through my career and like then I think maybe I focus on one point which I want to make here is like what changed me is like take opportunities when they are there. And really they are like through my career, like I did my PhD in Basel in Switzerland, worked already, like I'm a pharmacist by training, did my PhD in pharmaceutical technology, had some other research stints focusing on genome editing of the liver, then on toxicity and safety, and joined Pieter Cullis in 2018 in Vancouver. Because he was known for translating medicines from the bench side to the bedside, like really transforming and translating technologies which are developed in his lab into companies, which then drive them into the clinic and into approval. And there, what was really important, they are throughout life. No one can tell you like exactly when things are there and what happens. But when the doors are open, you also have to be ready to say, yes, I stepped through that. And this was really important for me that I was focused on academia, as you said, like I've done my PhD, I've done a postdoc. I love science and I still love, do love academia. It's just in academia, you focus more on, I would say, on the basic science. And there's this kind of maybe vicious circle of like publishing, getting grants and some bureaucracy. And it's really important, this basic science, and some labs are maybe more translational than others, but like the basic science is really important. But as a company, you work with, pharma, biotech, and the focus is to translate that science to the patient. So it doesn't stop there. It's really the focus is you need to develop that technology that it becomes a therapy. And that is really like what is hugely motivating for me.
Yes. You mentioned that moment when you joined NanoVation, and what were you thinking back then? I mean, changing from academia to the biotech world, to the corporate world somehow. What was easy? What was difficult?
Easy was if you have great team members and great support. So starting off with Pieter Cullis, who I joined in 2018 in his academic lab, we built this nanomedicine network, and then COVID came and there was a lot of interest. And Pieter had started various companies before, and he had always started these companies with scientists from his lab and like friends and researchers he likes to work with. And like having this mentor who like believes in you and gives you this opportunity, because when I joined Pieter initially, I haven't had planned to start NanoVation. but there was this opportunity, and he encouraged myself, as well as then Jay Kulkarni, my co-founder and chief scientific officer of NanoVation. Hey, let's spin this out of this nanomedicine network, which we have, and actually like start the company. So we started NanoVation in 2020. So it was this support, but also this is what I always tell others when they are thinking about starting a company. I would never start a company alone. Like, it's so helpful to have someone on your side. Like I had Jay, like exchange ideas and like talk about things, because when you start as a company of two, like even so, Jay became the co-founding CSO and I became the co-founding CEO. I always like to say you are the C whatever is needed at that moment, because you have to organize laptops, a laboratory. You need to take care of workplace safety, like suppliers, legal agreements, employment agreements. You have to do everything, which is then maybe on the one hand side challenging because you haven't been exposed to that in academia. On the other hand, your learning curve is like incredibly steep. And it's fun, and I like to learn new things.
Yeah. So that piece, I didn't know exactly. So you actually knew Pieter for 2 years before you co-founded NanoVation, right?
Yeah. So did you want to like ask a specific question, or like just how this came together?
Well, I think there are some conversations and kind of testing also on the other side, kind of scrutiny on the other side for yourself as well. And also some general thoughts, right? But I'm interested in that conversations and that relationship.
Yeah, and I would say it started really off that I did my PhD in Switzerland and postdoc. And then I knew together with my wife, we want to go abroad before the kids go to school. And so we decided then, let's think about where we could go. And I applied also for research funding from the Swiss National Science Foundation. So I was lucky to be granted one of these precious grants. And then I could choose wherever I want to go. And I knew people from the Netherlands who have been at that time in Pieter Cullis' lab at University of British Columbia in Vancouver. So I chatted first with Roy, who is now a professor in Eindhoven, and talked with him about like how was it to be with Pieter. And Pieter was really well known in the field because he had already translated various drugs into the clinic, various medicines. And then I met Pieter. I had met Pieter first time in 2015 already at a conference because, he has been like close to 50 years in that field. And then I met him in 2017 when I was already granted this funding. So like we then discussed details, had several calls. And then in 2018, together with the family, we moved to Canada and then stayed there like for several years and was really like building this relationship. Like Pieter's a person who gives you full trust. So together with Jay, who was also like working in Pieter's lab at that time when I joined, and Roy, who was also a postdoc, we really like managed the lab. We had like dealt with all the different projects, and like Pieter gave us the freedom to really develop our ideas and collaborate. And I love to work with other people. And so collaborated across the globe with various top-notch scientists and developed new technologies for genetic medicines. And this really then came to that moment that there was the opportunity to start NanoVation, because during COVID, there had been 2 companies from the US and 2 companies from Europe contacting us because of our strong expertise and encouraged us, hey, we somehow want to find a way to work with you. And being at the university or at that time, being in this nanomedicine network, it's not as easy to work with other companies because of agreements. And then it was clear, okay, we have to spin this out of this nanomedicine network and be completely independent of the university to get NanoVation off the ground. And that was really, Pieter who encouraged us. And then we took the opportunity, and I would always do it again.
How much uncertainty was there, and did you like it?
There was for sure uncertainty, but there, maybe going back to my point, I'm a positive person. My statement is always, there's always risk in life. And at that time, obviously, like when we started NanoVation, Lotta wasn't yet diagnosed with leukemia. So I know now things can happen all the time and you cannot control everything. And you can control some things and you have to stay clear and focused, but some things you cannot control. So for sure, there has been uncertainty at that time. But like, if you don't take the risk and take this opportunity, you will never find out what the risks are and what the uncertainty is. And I feel quite comfortable with that situation. Like also being a scientist, there are so many experiments and studies which fail. But what motivates me always is like, at one point it might work. And then I'm the first person in the world who has discovered that phenomena of science. And this is what drives me. Like I can live quite well with uncertainty, to be honest.
Yes. Did you have an exit plan at this point? Or even thought about an exit? Well, I'm looking, for example, I don't want to give you the words, but just an idea that other people said, well, if this doesn't work in 12 months, I have to look for something else. Was this part of your thinking?
No, if I commit to something, I'm committed to it.
Yeah.
And I will build and continue to build NanoVation. And for sure, there will be other opportunities after the time of NanoVation. When this will be, I don't know. But my point is always similar, to when you marry someone. You go into a marriage, not with thinking, when do I exit that already?
Not.
And this is how I see starting companies. I go into that marriage and start this off with the mindset, this should be a success. And I think this is important.
What was your relationship with entrepreneurship at this point? Were you very naive? Were you very focused? Did you know you have to take a lot of risk? How, if you think back now, your entrepreneurship skills from 1 to 10, where were they?
Well, from 1 to 10, for sure a single digit. But I think it's really about learning by doing and going through the process. For sure, I fully agree with having started once a company, I would always do it again. And for sure, there are hundreds of learnings throughout that where I have a much better starting point.
Do you have a story about you being very naive?
Yeah, that's a good question. Maybe initially, in certain partnerships and we had close after, shortly after we started NanoVation, we had a really big pharma working with us, and the negotiations took quite a lot of time. And at the end, maybe naive that they then shut down all their genetic medicines effort, and then this opportunity was gone. So maybe naive in a way that I initially thought, okay, if I'm so close to a partnership deal and a potential partnership, things should work out. But this to the point, you cannot control everything. You always have to keep opportunities and different opportunities up, because there can, for sure, until the signature is on paper, there can always things go wrong. And this is maybe naivety in the sense of you have to always push for it.
So you didn't make the deal?
No, that deal not. But then there were others. So I would say, one learning is for sure you have to continue to drive partnerships, and then it's about the science and it's about the data you have at the end. And then it's also a lot of other things you cannot influence, like the market, maybe new therapies which gets developed, which are better than the technology you were working on. So there are some
you run against time.
Yeah, for sure, time. And this also maybe something I learned because of my personal experience, how important time is. Time is and the urgency. And there are a lot of, translating this to patients, there are a lot of patients and families waiting for therapy. So time is of essence. But things take time, and drug development is a very long process. And there's a lot of uncertainty, and you have to go through a lot of different steps. But you need to keep pushing.
Yeah. What are your learnings on building teams and recruiting and shaping culture and letting people go? Yeah, do you have examples about that?
Yeah, building team, I would say we were quite lucky that the initial team, let's say maybe up to 20 people or so, we hired a lot of people with whom Jay and myself have worked with. So we knew the people, we knew their skill set, we knew their, let's say, personalities, which helped a lot. From the first employee to then the other ones we hired afterwards, it was a pleasure because we knew how to work together. Then obviously when you grow as a company, you also then have people in culture like consultants or internal like team members who deal with the recruitment. Let's say one part is when you recruit people is definitely skill set, but then personality is so important. And maybe that's also learning it. The bigger the team gets, the more personalities come together. And then there are always new things you have to deal with in terms of how to structure the team, how to maybe improve management of certain team members, how to restructure certain teams. And yes, if you have to let go of people, it's quite sad and challenging. But at one point, you also, for example, if there are team members who always there's some friction with others, at one point you have to realize, okay, maybe you cannot kind of change that person or adapt the situation. So you have to take actions. It's not easy, but that's the way it is. And this is definitely one key learning that, you can, I'm always solution oriented and you can try to find solutions, but changing personalities, I would say, is sheer impossible. So if there's a certain personality characteristics where which leads to friction, you cannot actually change it. So you have then also be honest to yourself and to the other team members, and then potentially let someone go. What I think is important there is communication. It's talking to the team, talking with your co-founders, talking to that person. But at the same time, obviously, you change the trajectory of that person. So I'm fully aware of that. So anyone who left NanoVation, I always try to keep a good relationship and also help them to find new jobs. Because at the end, I always like to say, you see, like there are always two moments in life when you see each other. So maybe that person is coming together with you as a partner from another company. So I think it's really important to also realize that, some things don't work out.
Yeah.
You go, different ways, but then maybe the ways cross each other again.
Yeah. When you build teams, when you recruit people now, I think you do it differently now than in the early stages or in the early times of NanoVation. And you said you look at personality types. What is your strategy there? Understanding personality.
Yeah. So maybe to the process, like obviously when we have been much smaller, then like I had interviews with anyone we hire. At one point, you just cannot handle that anymore. But then it's important during our process now, we have like people culture doing like the first kind of stages, then the hiring manager. But then what has always been important from the start to now, team members who will work with that person will be part of the final stage. So like if there are like 5 team members in that team and like 4 of them say, I don't think it clicks with that person, we will not hire that person, because at the end, they have to work together with that person and this hire. So I think that's key. And I think I would say like I'm a people person, so I think I have a good analytical skill to quickly see behind the scenes or see some maybe characteristics of that person. So I always like to jump on a quick call, like before, or even when we have hired that person, and this nanovator, like to indicate like certain directions, also explain that people should like be very open and constructive and ask questions. And then how people react, I think I can have a good skill set to analyze and to understand what could be strength of the person, but what could be like potential weaknesses. Yeah.
There's a difference between, understanding psychology and understanding how people react under stress. Do you know how you react under stress? Do you communicate that with people?
Yes. And there, let's say, first starting with how I react to stress, given that I have experienced like really devastating moment in our life, I deal completely differently now with stress. Because when there's a stressful moment, I always have kind of the toolkit of like stepping out of the situation, analyzing what is the problem and putting it into perspective. And like having seen your kid and your child in like devastating situations with cancer, and like also seeing your kid next to the bed, like passing away, it brings everything into perspective. And then like if there's a stressful moment, I can easily step out and say, okay, the world will not break apart if I don't solve this within the next hour. At the same time, I then need to focus on that's the problem. What are potential solutions? And this is also what we try to tell to the team. You have to, if there's a problem, come with solutions, because otherwise we cannot overcome that problem. In terms of, like how others and how to communicate, we had like leadership training with various team members and try to encourage that. Like one learning is definitely to communicate, like either giving short feedback. Hey, like I have a lot on my table. Be patient. I will get back to you and shortly feedback. And also team members know if I do not immediately write back, I will get back, but maybe I will take time. And also I really don't mind if people write twice because something is urgent.
Yeah.
I just need to, it's always about prioritization. I need to understand what are the priorities and tackle these first.
You said that events that your child had cancer and passed away was a very stressful time, and it shaped you. What else is now important that was not important before? What kind of identity do you have now? What focus do you have now?
I would say it didn't completely change, like not 180 degree change, but definitely like had like a different level of impact in terms of how I behave. So the point of having impact, it's really about like having impact to develop therapies which help patients, but also impact on people. Like I really see that what I mentioned, like career trajectories. I see the team and nanovators who join us, I will influence their career. I will influence their career in how I interact with them, how I influence their leadership skills, how I like also to be vulnerable. If I don't know things, I'm the first one to admit this, because I think what is the most wrong thing you can do is like not saying that you're wrong, because then it can be very expensive. admit it as fast as possible and find solutions together. It's like, I don't have the solution to everything, but hopefully someone of the team has it and we can discuss it together. So this being vulnerable for sure, and like being open about this, but also really being laser focused on having an impact, and like also seeing behind people, like not seeing like what you see when you meet a person for the first time, but like I'm really curious about like stories, like stories of other people, and you learn a lot, like how they grew up, what they have, what they love, what they don't love. So I love this, and it also helped me to realize that if I am open with my situation, I have met various people like who I work now also closely, like advisors, consultants of NanoVation, but even like some of our like partner companies who then said they lost their wife. And it's good to talk about this with them because you realize, okay, you have like some things in common, which you don't never want to have in common. Yeah. But this really helps then to build a relationship.
Yeah. You said impact. I like the word. For many people, it means different things. What does it mean for you?
Impact is always, as we talked through the entire like time so far, is like patients. So it's really like impact means for me like building something which at the end helps patients. And that's the North Star I always follow. There are other things from a company perspective. Let's say what means success for me or impact is like, impact for people, for team members, really empowering people we have in the team, our partners, to make them successful, or like also obviously we have like a responsibility for our shareholders and like having there some like, let's say, impact. But at the end, the North Star is the patient. And if we are able to develop therapies for these patients and solve a delivery problem with NanoVation, this will also have impact on these other parts. Like the team will be very motivated and they are motivated if we solve delivery problems and come up with new ideas. The shareholders will profit from that, as well as our partners who drive that into the clinic or maybe manufacture that therapy. So I think if you keep be focused on that North Star, everything else will come with it. And this is really like what means having an impact for me.
Yeah, assuming, let's say in 5 years, there's a major breakthrough in a therapy where NanoVation was developing a big part of it with the LNP technology. Assuming you save a child's life, what does it do with you? What will it do with you?
I already can feel it now. Like it would be incredible. It would be the most precious thing I could have. Because then I have really like achieved one part to why I'm doing that all day long and like every day and being motivated. And I love what I do. It's really to help a family. And I would definitely like first think about my daughter and that she helped me to get to that point. And if I have a chance to meet that family, I would love it. But obviously I don't know like if that situation would be there, but for sure it would be like a very, happy moment for me.
Yes. Let me ask a follow-up question because I'm trying to understand what you really think. Why is that important?
I would say, why is it important that we do this every day? And this is like
no. What I mean is, why is it important that you would be able to relate a success in the thought of your daughter?
To answer it maybe that way, that I was not as lucky that Lotta, even though she had various different medications, different treatment schemes, we were not lucky enough to have this therapy which helps her to survive cancer. And cancer is a devastating disease. And I think it's really about that NanoVation, the team we have, myself, have been able to develop together with partners a therapy which solves that. I think it's really about that I myself have not been lucky enough because of the time, because the therapy wasn't there. Science is incredibly like complex.
Yeah.
Other companies did not come up with a solution to that.
Yeah.
I think it's really that I see myself back how I dealt with the situation. We weren't not lucky, and now like I can really have this success.
Yeah. In which disease modalities, in which indications will LNPs have the biggest impact?
I would say they already have a really big impact with it. Let's say
vaccines, for example. Yeah.
Vaccines, exactly. But the next big waves, which are like ongoing, is cancer vaccines, like preventive or like actually as a kind of a treatment. Like cancer vaccines show incredibly potent like outcomes in patients in combination with other therapies because our immune system has evolved over millions of years. So, and the problem with cancer, for example, is that cancer kind of like found a way to escape from our immune system. So with cancer vaccines and immunotherapies, we're able to actually like boost our immune system to attack the cancer. And this is definitely cancer vaccines, a big one. Then in vivo CAR T therapies for also like modifying T cells, like specific immune cells in our body to attack cancer. Also then autoimmune diseases where you have an overreactive immune system. So there, I would say it just starts. And I think I always like to say, or take a quote from Ugo Shahin, the still current CEO of Biotech, who said like, by the mid of 2030, 1/3 of all drugs will be genetic medicine based. And there are like also market analysts who say, yeah, this will be $100 billion market. Like there are so many diseases you can tackle, because not only because of the LNP itself, because we have a much better understanding of diseases like genetic diseases. And we can now really like go in and cure these diseases because we know the symptom, not only the symptoms, but we know the origin of the disease and we can correct that disease. And that is such a powerful strategy and approach. But what you need always is the delivery solution to bring these drugs into the specific organs.
Yes. Is there a kind of ranking between diseases you would like to work on? I don't know if you want to say it, but cancer in children is something else than Alzheimer or neurodegenerative diseases. It's a different group. And I think it's also more difficult to develop one thing against the other. But I'm trying to understand if you have that kind of ranking in your mind.
For sure, I have a different relationship to cancer because I've seen what this really means. And like that also the current medicines we have are mostly stemming from decades ago. And like, even so there are new therapies at the end, like when you look to survival curves, the current therapies in average, maybe sometimes extend survival 3 months, 6 months, which means nothing. And also like you have to understand that during this 3 to 6 months, there are a lot of side effects. So it's not that you live like if you have a healthy super life. And so like cancer is definitely, because I have seen how devastating it is, like a focus, and like I'm motivated by these projects with partners, but I would take a different approach to this. Like one part is my personal story and like the focus on cancer, and that I have seen what this means. On the other hand, then I've started a company developing technologies, and this has to be driven by the science and the biology.
Yeah.
So like, even so I'm motivated by these projects, I follow, and I'm most motivated in the projects where I see the technology is like aligned with what we want to achieve. And if this is cancer or genetic disease or an autoimmune disease, then at the end doesn't matter too much for me if I know we have something in our hands which is incredibly powerful and could overcome these challenges.
Yes. Do you encourage companies to meet patients?
100%.
Why?
It changes so much. I would say before that happened with Lotta, like you don't meet like on a regular basis patients, and like everyone maybe has family members or friends who had cancer, but if it's a close family member, you have a completely different perspective on that. And everyone, what I always like to say is like lives kind of in a bubble, and you haven't seen what this really means. So why I'm so open about my story is like to tell the people what it means, and also like told the story and showed photos to my team, quite personal moments and shared personal moments, but also show them videos from patients and like stories which you can find easily on YouTube, but which are very motivating when you see how therapies have like transformed certain like patients' life. And also maybe to go back, like as a scientist, you think about like what are the assays you're using, what are the studies, what is the work plan. A patient thinks about the next birthday, the next day when they feel better. So it's like completely different perspective. And I think what helps to talk to patients and know these patients is like how they feel and what incredible chance you have when you are able with a company to develop a therapy to help these patients.
What I heard in an interview of another person, and she said usually people from medical affairs are not allowed to speak to patients directly. So I didn't think about that problem, that many companies aren't even allowed to speak to patients. So what could be a solution to that?
That's a good question. I would say, I don't know, like, let's say we don't have medical affairs people within NanoVation, but I can, let's say, obviously, given like I have been in contact with various patient groups and families who lost their kids, I always have shared, and I asked them, are you okay if I share your story about your kid with my team? So I also have shared stories with the team. And then I think, let's say, talking to patients directly is one thing, but you can also like, I have contacted clinicians or like actually patients who are very active on LinkedIn and ask them, would you ever be willing to come to NanoVation, for example, or being at a conference and listening to their story? I think that one thing is meeting directly the patient, but also like talking to medical doctors and like patient associations, if they can maybe know someone, because patients also have to be willing to tell their story, because
Yes.
it's a quite vulnerable moment.
Yes. If you found a letter from your older self, assuming time travel or something like that.
Yeah.
If you found a letter from your older self, let's say Dominik with 80, writes you, Dominik, in today's years, what would he say?
Stay focused to have an impact which goes beyond the 80 years. I think everyone lives on this globe to have an impact. Like, I only have a certain time on this planet, and I want to do something which makes the world a slightly better place, and which goes beyond my time. And it's about how I treat others, how I empower others, how I grow up my kids, what I give to them, how they think about the world, how do they think about other people. And I think it's that I would write this letter and say, approach every day in the mindset of trying to make the world a better place. It sounds very broad, but I think it's really about that. There are so many little moments where you can make others happy, and also see when others need help and support them.
Would your older self be proud of you?
Positive persons, I would say yes.
Yes.
Yeah, yes, in a way, how I managed to deal with various situations throughout my life, but also taking opportunities and really driving these forward. And you talk about the future. There's one quote I love, and it's the best way to predict the future is to create it yourself.
Yes.
And this is really how I think about it. If I want to predict the future, I have to shape our scientific community. I have to shape the direction. I have to shape people who surround me in thinking how they can support others. What can you do in a day-to-day? And it's really about that I think I have now the power to shape the future. And this is incredibly motivating.
Yes, very good. Thank you very much. I think we end it here. Great conversation. Thank you very much,
Thanks
Dominik.
so much, Christian. It was a very pleasure. Thanks a lot.
Great pleasure. Thank you very much. Take care. Bye-bye.
Thanks.
Willing to Win. Biotech Leaders Against All Odds. A podcast with biotech leaders for biotech leaders. Stories about conviction. The good, the bad, the ugly.